Hello, friends. Today's topic is mental health. Before discussing about mental health, let us know about health. The World Health Organization (WHO) defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Mental health is clearly an integral part of this definition. Mental health describes either a level of cognitive or emotional well being, an individual's ability to enjoy life and procure a balance between life activities and effort to achieve psychological resilience, an absence of a mental disorder. Mental health is more than the absence of mental illness. The World Health Organization defines mental health as a state of well being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Mental health refers to a broad array of activities directly or indirectly related to the mental well being. It is related to the promotion of well being, the prevention of mental disorders, and the treatment and rehabilitation of people affected by mental disorders. Why mental health is important? Why we are giving so much priority for mental health? Because it has some value and some impact. Values of mental health are: mental health improves the quality of life. Mental health strengthens and support our ability to have healthy relationship, make good life choices, maintain physical health and well-being, handle the natural ups and downs of life, discover and grow towards our potential. Mental health facility reduce medical cost. Impacts of mental health are: disease prevalence, magnitude, burden of disorder, effects, suffering, economics, and DALI. DALI stands for Disability Adjusted Life Years. Magnitude: about 450 million people were estimated to be suffering from neuropsychiatric condition according to the data of 2001. Very old data though. Surveys conducted in developed as well as developing countries have shown that during their entire lifetime, more than 25% of individuals develop one or more mental or behavioral disorders. Effect: 10 to 20 million suicide attempts and the 1 million completed suicides every year worldwide. According to the data of WHO, Violence Homicidal Act etc. Having a mental illness can place an individual at higher risk for developing other illness. Suffering. Mental disorders cause psychological suffering to patients, their family, community. Make a number of adjustments and compromises that prevent other members of the family from achieving their full potential in work, social relationships, and leisure. These are the human aspect of the burden of mental disorders. which are difficult to access and quantify. Economic. The cost of mental illness in England adds up to Euro 77.4 billion, according to the data of 2003. This picture shows that how we can nourish our brain and make a healthy brain. Mental health is a combination of emotions, depression, psychological anxiety disorder, stress, cope, social, and many more. Misconceptions about mental health. Number one, mental disease is possessed by ghost witches. All mental illness is caused by sin. Someone is to blame for mental illness. Mentally, people are dangerous. Are they dangerous or not? British crime survey almost half 47% offender of violent crimes was under the influence of alcohol and about 17% believe that the offender was under the influence of other drug. Another survey suggested about 30% offenders attacked because they were under the influence of drug or alcohol. In contrast, only 1% of the violent incident happened because the offender had a mental illness. They do not get better. Patients should take drug for lifelong. Self-care is how you take your power back. Take care of yourself. Thank you.